Well, in most cases, the honest answer is we don't know the exact trigger. It's usually what we call a sporadic pituitary adenoma, a one-off event in the gland.
So bad luck, basically.
Sort of, yeah. Now, there are some rare genetic links. Conditions like MEN1, multiple endocrine neoplasia type 1, and FIPA, familial isolated pituitary adenoma, but these account for a really small fraction of cases.
So most people with a prolactinoma don't have one of these genetic conditions.
Correct. It's much more likely to be sporadic. But, studying those rare familial forms does give researchers clues about how pituitary tumors might develop in general.
Right. But the notes also stress something important. You can have high prolactin levels for reasons other than a prolactinoma. That seems crucial for diagnosis.
Absolutely critical. We need to distinguish hyperprolactinemia, just the state of having high prolactin, from actually having a tumor causing it. There are physiological, totally normal reasons for hyperprolactin.
Like pregnancy.
Exactly. Pregnancy, breastfeeding, those are expected times for hyperprolactin. But even things like significant physical or emotional stress or really intense exercise can temporarily bump up the levels.
Ah, okay. So a single high reading on a blood test isn't automatically a tumor alarm bell.
Definitely not. And then there are medications. This is the big one. Certain drugs can raise prolactin levels and mimic prolactinoma symptoms.
Which ones?
Some antipsychotics, like risperidone is a common example. Certain antidepressants, metoclopramide, which is used for nausea, even opioids. So reviewing someone's medication list is like step one.
Makes sense.
And then there are other medical conditions. Low thyroid function, hypothyroidism, that can do it. Chronic kidney disease, too. Even PCOS, polycystic ovary syndrome, has links. And finally, anything that physically interferes with dopamine getting from the hypothalamus down to the pituitary can cause prolactin to rise, like pressure on the pituitary stalk from a different kind of pituitary tumor or another growth nearby.
So lots of potential culprits. It really underlines why a careful diagnosis is needed.
Precisely. You can't just jump to conclusions based on one prolactin level.